Hello, I'm Gregory Davis, gynecologist in Chico, California. Thank you for joining us today. I would like to go over the grieving process with you, and you may think, well, why are you going to be talking about the grieving process? How does that relate to gynecology? Well, I have found that over the years, my patients frequently, through various diseases and problems that they're having, suffer with the grieving process and not going through it appropriately. So I thought what I would do today is just take you through the steps, and maybe this will help you to successfully get through the grieving process. So let's talk about the 4 stages of the grieving process. The first stage is the denial. And you know, for ladies that have been suffering with bleeding, or they've been suffering with pain with their periods, or they've been suffering with problems with their bladder, they may let this go on for years thinking, well, you know what? This is going to get better. It's going to go away. Maybe it's related to my hormones. Maybe I'm stressed at work. So there's a lot of reasons that ladies kind of go into denial and don't really address the issue. But when it finally reaches a crucial point where they're suffering enough and they come in to see me, then all of a sudden they realize, you know what? This is not what I signed up for. All of a sudden they realize that their life has taken a detour, and unfortunately the problem that they're having is not going to go away, and we're going to have to do something about it. So when they come in, they've gotten out of the denial phase, and now what happens is that when they realize, when we sit down and we're talking about their endometriosis or their need for a hysterectomy or their fibroids and bleeding or anemia or interstitial cystitis, any number of things, or needing hormone therapy and concerns about that, all of a sudden they get angry and they go, you know, this is really irritating. Why do I have to go through this? You know, why can't I just be normal? Why can't I be like everybody else and not have to deal with that? So the second phase is the anger phase. And third phase is, of course, kind of sad, kind of bummed out. And then, of course, resolution is the final stage. But you know what's interesting? Psychiatrists have done studies, and they've looked at people that successfully make it through the grieving process. And what they found is that in women, the most important phase for them to get through is the anger phase. But you know what? That's where the problem lies. Society doesn't let nice ladies like you get angry. You know, it's easy for guys to get angry and work through this part of the grieving process. They can throw things, yell, scream, play sports. It's easy to work through the anger phase for guys. The difficult thing for guys, of course, is the sad or the crying phase. So that's why it's tough for society and men getting through the grieving process with this stage. But for women, the anger is the toughest thing to get through. And so what happens is that we don't want you directing your anger at your support system, your husband, your boyfriend, or your family. Those are the people you need that are going to be there to help you. So what I have found after talking to psychiatrists that deal with this on a regular basis in studies that have been published is that how can we help you get through the anger phase in an appropriate, socially acceptable way? And here's what we do. I have my patients, I kind of explain the grieving process. We kind of go through these stages. And they realize that they do have a lot of anger. And I tell them, you know, what I would recommend is that I would have you get a piece of paper, notebook paper, and you take that and you just start on each line and you write down the things that you're angry about in this particular situation. And mind you, this goes for any grieving process, a loss of a spouse, loss of a job, loss of a good friend, any number of reasons for going through the grieving process. I think whenever your life takes a detour that you're not prepared for, then in a way you kind of go through the grieving process. So when you get into this anger phase, you need to take a piece of notebook paper and you need to sit down and write down all the things that you're angry about. The list may go for pages, but you're going to take the top thing on your list. Nobody needs to see your list. This is your own private list. Then what I would recommend you do is you got to find a place at your home where you want to get like a punching bag, a literal punching bag, one that guys kind of hit on, or a big bag. And wherever you can find one of those, and you want to put it in a place where you can get to it. And then what you need to do is you need to go to a toy store and you need to get a plastic wiffle bat so that you can wail away and you can hit on that plastic, or that plastic on that leather bag. Now, why do we have to do that? Well, studies have shown that when ladies are working through the anger phase, they need to make noise. And they need to make loud noise. It makes them feel better when they make the loud noise. And they need to be hitting something. Well, they've tried boxing gloves and things like that, and ladies broke their wrists, and those didn't work so well. So they found out that the plastic bat hitting a leather bag, making a nice pop, really works. So for you, you can go out and buy your cheap little plastic bat. You get to choose the color, and then you find your leather bag, hang that up, and I would suggest you take 10 minutes every day if you can. Take the top thing on your list, and you just focus on that top thing, and then for 10 minutes you're wailing away, hitting on this bag, focusing on the things you're really angry about related to that top subject that you have. So then when you're done, what you do is you put that list away. Nobody needs to see that. You walk out of the room. All the other things on your list, you're going to leave there, and you'll come back the next day and take care of that. Now, if somebody or something happens that day that really gets you ticked off, well, they may go to the top of your list and be taken care of the next day. So what I have found is that this has worked extremely well for women to get through the grieving process if they can get through the anger phase. And you know what? It works. And once you get through the anger phase and you've worked it out and it's socially acceptable, sure, you're going to get through the crying phase. You're going to be a little bummed out. But then, as you've worked through the anger, then all of a sudden, resolution is going to start to take place. Now, resolution may take a long time depending on the situation that we're looking at. And for some people who have a chronic medical condition, well, that resolution may be a little bit variable. It may be the fact that you get your symptoms taken care of. Yes, you may have flare-ups in the future, but if we can get you back to feeling normal and psychologically you've gotten through and over that and it's kind of resolved that issue, then you're going to do well. So just remember, the most important phase for women to go through is the anger phase. And I'm giving you permission that it's okay to get angry. But just leave it at using a plastic bat on a leather punching bag, and I think you're going to find that that's very helpful. Now let me just clarify in the closing here a couple of things. You don't have to have a leather punching bag. You can use a rolled up sleeping bag, a big pillow, but you want to use something that's going to make some noise because that has been shown to be very helpful. The other thing is that, remember, you want to take your anger out in this appropriate situation. You don't want to take your anger out on your husband or your boyfriend or your family. Those are your support system. Those are the people you need. So I think what you're going to find is that if you can work through the anger phase and you can get through it, you're going to do great.